Can medications for diabetes and weight loss cause night sweats? Night sweats are not a recognized side effect of GLP-1 medications, according to FDA prescribing information and clinical trials. If you're taking a GLP-1 medication and waking up drenched in sweat, you're probably wondering if the medication is causing it. Let's talk about what the research actually shows and what might really be going on. First, let's understand what we're dealing with. GLP-1 receptor agonists like semaglutide work by mimicking a natural hormone your body produces after eating. There's also tirzepatide, which is a related but distinct medication that acts as a dual GIP and GLP-1 receptor agonist. These medications have become widely used for managing type 2 diabetes and are associated with weight loss. They work by stimulating insulin release when your blood sugar is elevated and suppressing glucagon, a hormone that raises blood sugar. They also slow down how quickly your stomach empties, which helps you feel fuller longer and reduces appetite through effects on hunger centers in your brain. Now, here's the key point about night sweats. According to FDA prescribing information and clinical trial data, night sweats are not a recognized side effect of these medications. Clinical trials haven't established a direct link between these drugs and waking up sweating at night. So what side effects are actually common? They're primarily gastrointestinal. Nausea can affect 15 to 44% of people. Vomiting, diarrhea, and constipation are also reported. These symptoms are typically most noticeable when you first start the medication or when your dose is increased. There's also an important safety warning you should know about. All GLP-1 medications carry a boxed warning for thyroid C-cell tumor risk. They're not appropriate for people with a personal or family history of medullary thyroid carcinoma or a condition called MEN2. But back to night sweats. If you're experiencing them while taking one of these medications, something else is likely going on that needs investigation. One possibility is hypoglycemia or low blood sugar. This is especially worth considering if you're taking other diabetes medications alongside your therapy, particularly insulin or sulfonylureas. Low blood sugar can definitely cause sweating, including at night. Infections are another common cause of night sweats. Your body raises its temperature to fight off infections, which can lead to sweating. Hormonal changes can also be responsible, particularly in women going through perimenopause or menopause. Other medications you're taking might be contributing, and in some cases, night sweats can signal underlying conditions that need medical attention. If you're experiencing night sweats while on therapy, this is definitely something to bring up with your healthcare provider. They can help figure out what's actually causing the symptom. This might involve checking your blood sugar levels, reviewing all your medications for potential interactions, and evaluating for other medical conditions. You should contact your doctor, especially if your night sweats are persistent or severe. If they're accompanied by other concerning symptoms like unexplained weight loss beyond what you'd expect, fever or confusion, don't wait. If you experience night sweats with high fever, severe confusion, chest pain, or other emergent symptoms, seek urgent care. Your healthcare provider might adjust your diabetes medications if hypoglycemia is suspected. They might order tests to rule out infections or other conditions. The important thing is not to assume the night sweats are just part of taking the medication because the evidence doesn't support that connection. So let's recap. Night sweats aren't a recognized side effect of GLP-1 receptor agonists or tirzepatide, according to clinical trial data and FDA information. If you're experiencing them, other causes need to be investigated, and any persistent or concerning symptoms should be discussed with your healthcare provider for proper evaluation. Remember, this information is educational and not a substitute for personalized medical advice. Always consult with your healthcare professional about any symptoms you're experiencing. Have you experienced unexpected symptoms while on therapy? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information from Fella Health.